much. Appreciate it. Glad everybody got together tonight to kind of talk about something called a hackathon. How many of you have heard of a hackathon before? It's kind of a new term. It's really big into the IT world, but as far as in the engineering world, facility management world, or support to facility infrastructure, I don't think many of those have been done. I can assure you I will not have a PowerPoint presentation that you have to watch 100 slides or so of. You'll have many of the presentations that will be spectacular to take a look at. We're doing something different than you may have ever experienced before, and that is to think about how to go about and rapidly design a solution that you think would improve the patient care experience. Now, it's interesting when I say patient because we may need to back up a little bit and say customer/patient, because in the idea, this whole idea of population health or proactive health management that we've all heard more and more about, is that person really a patient? If your wellness is such that you're taking care of yourself, how does that work? I was at Mount Sinai Medical Center here a few weeks ago in New York City, and they were talking about statistically that 10% of negative health outcomes actually happen within the healthcare setting. 30% are genetically related. You inherit these health issues that you deal with your entire life. And the remaining 60% are ones you have some sense of control about how you manage your health. So it's interesting we have this sort of 60% aspect of how do we have an impact on our health from that perspective. So in the hackathon, to tell you how this really works is, it's this idea of rapid development of ideas to push it into some kind of an idea that you could say, we could give something to test and experiment with. I need to ask you a few things to do tonight before you get started though. And the first thing is that you have to unlearn everything that you've learned about healthcare facility management. Because if you think about it, how many disruptive innovations have happened within an established, already existing large industry? Many times it happens outside because they have sort of a fresh look and fresh perspective. So there's a tendency when you're looking at ideas tonight to try to find the facts, be a fact finder, you've got to be right. You have to understand how this works. Just forget all that stuff. Check that all at the door and say, I'm going to look at this in a whole different perspective of looking at how to solve a problem if there weren't any restraints to think about. Second is that the ideas you're coming up with is don't think that it has to be perfect. Many times when new businesses start up, they're not perfect. They're far from perfect. In fact, they're really kind of clunky. But over time, they improve to a point where they become something of value. So we're going to actually be using information from each of you. We're going to be breaking the teams here for a second. And I'll tell you a little bit about how that's going to work. We'll probably, by looking at the number here, count off 1 through 5. And I purposely want different people that haven't known each other, if they're sitting together, to assemble these groups. And within these groups, you're going to identify a person that's going to be considered a team leader. So that individual will represent the group as far as kind of logistically handling the discussion. But I also want to make sure that each of you have an opportunity to speak. It's very easy for a person to maybe dominate more of the conversation than another. So it's the team leader's responsibility to make sure everybody has a chance, an opportunity to speak about this particular topic you choose. So how it will work is as we break into groups, then the context of the discussion is very simply this. If you have the ability to improve a patient or customer experience, what are the kind of things would you do to make that happen? Then you're going to center on kind of a project area that you want to focus on. You'll come up here at the very beginning and say, we're going to take on this particular job, and then go back to and work specifically on how to address that, and then come back up and say, okay, what did you come up with? The reason for that is if we have any of the same area, we might make some adjustments. So you might think of 2 or 3 ideas as to what you want to solve to come up with a problem. So let me give you an example to give you some thought to think about. You know, we all have to have annual exams, right? Or we should have annual exams. We may not go have those. But maybe the reason you don't have annual exams is because it's such a hassle to do those, right? It's how you go about doing that. So if you would think to yourself, how would I more effectively have an annual exam conducted? What would I need to have happen? How would I make the experience so easy that I can get my annual exam done? The other thing that's unique about this group, too, as we're getting ideas, is I've had it said that many times the smartest people don't work for your company. So we're bringing all these people in to cross-pollinate knowledge to have the ability to come up with some things we haven't thought about. So please kind of don't look at your solutions as having to be absolutely right or from what you come from contextually, but to how you might go about doing it in a whole new way if you're starting with a blank sheet of paper. Now this might be, some people are going, oh my gosh, another group exercise. I just want to have somebody talk to me. I don't want to have a get together and hash that out. But I think you'll find it really fun and exciting to do that. So what I'm going to do is we'll just go around the table, just call out your number, and we'll just go 1 through 5. And we'll just start at this side over here. We'll start with the gentleman who's standing right there. You're number 1. 1, 2. Whoever says first. Andre? All right, so you know your numbers. Let's kind of do it this way. If your number, oh, there's a 4 there. Okay, good. Let's see. So we got. Let's go with the 1s, 2, 3, 4, 5. Let's go that way. So 1s will start over here. 2 in this area, 3 in this area, 4 and 5. Good to see you, man. How are you? Good to see you. I know it has been. How you been? Let's see. Where's Hannah? Hannah. Oh, good. Hannah, can you go? Okay, let's go ahead and bring up the slide of the questions or the problem areas that were identified. All right, so I want to also share, there was a survey conducted, an email went out a couple weeks ago to talk about what your pain points were to help stimulate our discussion this evening. And so these are the biggest pain points: capital planning process, having a good capital plan and executing it, adjusting it. With a new consumer-focused emphasis, what can we learn from the retail and hospitality to elevate our customer service and patient-centered design? Providing bricks and mortar for healthcare for the new delivery model and cost-effective strategies to pay for it. How do we integrate into a more coordinated healthcare industry? Navigating organizations in transition, planning and making decisions amid market volatility, and how to keep up with technology changing daily. So these are thought starters, but I want to again just throw these on the board, but you don't have to stick with what's on here. What I'm going to do is give each table, this group here, I'll say go, and you try to pick a topic that you think is a very compelling thing that you could change. For example, I'm throwing ideas. Let's say, what is the problem with insurance that's affecting the healthcare delivery that you think you could fix? That's a big one, isn't it? What could you do to ultimately provide care to a patient much more effectively and efficiency? How could you improve the sort of siloed, congested, cumbersome healthcare delivery system that many of us has personally gone through that we can help fix? I work for a large healthcare system, HCA, so we're a big fee-for-service, basically provide healthcare services for patients and have healthcare services, urgent care, surgery centers, et cetera. And so in the business that we deliver healthcare, the big question is how can we even disrupt ourselves in this healthcare space? So I'm going to ask you for a second to pretend like you don't work for a healthcare company. You're looking at how to solve a problem, and you're attacking it from that perspective. So what I'd like you to do is to go ahead and identify your team leader. Make sure you know everyone at the table. Take a few minutes to say, what do you think are some of the problems? You got one more? Okay. Why don't you join us right over on this side, sir? And let's go ahead and get started. Yeah, the object is you don't have to pick one on this list above. A question was brought up, should we pick one on the list? You can, or come up with your own idea. It doesn't have to be on the list. These are just some thought starters. But it's wide open, blue ocean, to be able to pick what you want. Guys, just go ahead. We may, I want you to start another group. Tell you what, you guys want to just grab this table right here? Or anytime you want, just together, the three of you. You want to come here? How about this group just came in? What do you think about? Yeah, there's only three there. I thought that way, then all you guys at the same time. Oh, great.
I'm Ray. Hey there, how you doing? Okay. Okay.
Sort of, I want to learn everything you learned about healthcare.
Okay.
I'm at Russia, so how would I make it experience?
Yep.
So I use the example of the street. What is that like today?
Cool. Okay.
Is there anybody that's ready to come forward and pitch their idea? And the reason I ask if there's any early people, then other people would see how you're approaching it, may help them fuel their thoughts as well. Apparently not. Yes, sir. If you have one to pick, I think it'd be great because you can come up and give an example of one. They kind of hear how that works. What do you think? Okay, we have our first proposal to try to solve an issue, a job to be done. So go ahead and make your introduction.
Hi, I'm the spokesperson for Team 4, and woohoo! We're number 4. We happen to have a couple of representatives from children's hospitals, and so the last one sort of piqued our interest, which was how to keep up with technology changing daily and looking at it from more of a preventable standpoint, so bringing the clients or the patients as kids, not always having to have them come into the bricks and mortars building, but how can we leverage technology and look at the preventative ways that we can deal with healthcare, and that's about it.
Okay, Kristen gave a great example, so now they're going to go to work to come back to us later in the session to tell us what are some of the 2 or 3 things, ideas that they think might move the needle, so to speak. And again, be creative, be wild. It may not make sense, but that's part of what we're trying to develop here. We're going to, again, take notes as each team is coming up with this, and we'll have a list we'll share with everyone. Anytime anybody else is ready, raise your hand. You can come on up. I hear a lot of great discussion and conversation going on. That's great. You know, as you think about the situation, the stage we're on, we've got, you know, people are living longer, healthcare costs are going up higher, and we're thinking, how in the world do we pay for this? So again, if you think of some ideas how to help solve that, that's great. You have one? Yeah, come on up. All right, go right ahead. All right, we've got another team lead here giving us their proposal. Andy?
All right, so one thing that we thought about was the patient experience in the physical facility and how the healthcare industry might be able to learn something from the hospitality industry. And so we thought of ideas about making better wayfinding, possible use of a concierge, and making the hospital generally have a less clinical feeling, at least when you walk in. And those were the things we thought about. Also, just as a side note, anybody watch the Ohio State-Iowa game? I'm an Ohio State fan, so I was kind of sad, but the first quarter wave to the Children's Hospital, if you have not seen that, go to YouTube and just Google Iowa first quarter wave. It is the most incredible connection to a children's hospital. It's hard for me to even talk about it. It's just a beautiful tradition that got started this year, so look that up.
Thanks for sharing that. So they'll be looking at ways to come back later onto the stage and tell specifically some thoughts of how they might develop an experiment to test these ideas and see if their ideas can be done or might work or what it might look like. All right, I need to have another team come forward and identify their project. Who's ready? While you're all talking, in a typical IT hackathon, they literally can go, they're actually building software code based on a concept they want to fix something. For example, I was a judge to one event where they had a coffee roaster and they actually wired it up to the environmental conditions of where they were at with the humidity, temperature, to optimize the roast of coffee beans anywhere in the country. So, they actually came up with a device and were able to show that. So if you were to develop a prototype, for example, we were talking about how might that look as a way to think about it. We don't have as much time as they have. These can go on for 36 hours, and they get very little sleep, but we're not going to be here that long, of course. So we got a few more tables working on coming up with their pitch. So what is your pitch? What is your pitch to try to help solve the healthcare system problems? How do you improve and make the patient care experience better than it is today? Ready? All right. We've got team 3 coming up. You ready, Joe? Yeah. Oh, Hannah, can you switch back to the list of problems? Okay.
Okay, I'm representing Group 3 here. I think the issue we're going to take on is mostly planning and making decisions amongst market volatility, specifically targeting potential acquisition targets and mitigating some of the issues and concerns and problems that come along with that.
Good, thank you. All right, we got 3 teams. We're halfway there. We're halfway there. Need 3 more announcements of what your pitch is for what you want to work on, what problem you want to solve. Think about all of you having the power and the ability to implement change, that you can come up with these ideas that would really transform healthcare. So let's keep moving. We got any luck here? We have a team lead. All right. It's hard to solve. So don't think of current laws or regulations, right? That would bring your ideas crushing to the ground. So let's say you don't have any rules. You know what? Anything is out there. Be as crazy as you want to be, and don't be worried. Don't worry about it. Okay, I should have counted down. 5, 4. Okay. All right, team 1.
We kind of played off your idea, Brian, and we were looking at, the patient experience related to annual health screenings and how much of a drudgery that is for most people. And our mission statement with regard to this was keeping people healthy through improved access to health screenings and predictive and preventative health, those things. And so our goal was to get more people into it, which is access, and then for it to be more convenient for people to want to use it, which has got something to do with location and time. Then also a better process where it's more of a humanized experience so people don't feel so encumbered to want to go out and do it. They're intimidated by the process. And then a better outcome, which is as a result of the 3 that I just mentioned above.
So in summary, what you call the project is to improve the patient experience.
Improve the patient experience.
So as Group 1 has come to look at improving the patient experience, they're going to then come forward and kind of say, here are some specific solutions how to do that. I want to make another mention about kind of a factoid here. I think that everybody talks about big data, structured data, unstructured data, and so in meeting with the folks at IBM Watson on healthcare a few weeks ago, talking about what's the issue with big data. Think of big data, if you think in healthcare, it's sort of the new oil. It's a new way of how to get data and use it in an effective and an efficient way. So as you're looking at your solutions, how would data, how might mobile technology, how might things that would be at the disposal of how things work be better to deliver your solution? That was your idea, right? Dang it. There are some out there that experiment with the idea of having healthcare delivery done without insurance at all. So how would you set something up to be able to accomplish that of healthcare delivery where people pay for their own healthcare versus having to use insurance? Just another idea I'm throwing out there. All right. I'll just jump in the ocean, you know? All right.
We're group 5. We're group 5, and we're going to focus on moving care closer to the patient's home, like in terms of wellness, telehealth, reducing visits. That's primarily our goal.
All right, thank you. The fuse is about burned out. You got to call your project. May not be perfect, but give it a whirl. Who's your team lead?
That's true.
And you're gonna look.
Was that?
So we're going to look at the healthcare experience from home care and how to improve that and get more people through technology and home services serviced without having to leave their neighborhood.
Great. And that's another great topic. And some of this is going to overlap, and that's okay. We'll take the best of the ideas, or all the ideas actually. I don't know if there's a best idea, but we'll list all the ideas in a way to learn from that experience. So you're all managing time. At 6:10, we're going to start the process of each table coming up and giving their story around what they earlier pitched upon. So watch your clocks. We will begin at 6:10 and I'll go ahead and make sure that know who's first, second, and third. But 6:10 we will start. All right, we've got about 6 minutes left. Starting to come back. All right, if there is a team that is ready early and they want to go ahead and get in front of everyone and get this over with, so to speak, raise your hand. Just let me know. You can start now. No problem. You got applause already? You got it? You guys ready? All right, I'm going to introduce to everyone Team 2. Oh, one second, please. Just got to pause. I was going to do a great intro, you know. We'll just pause on that for a second. Just thumbs up when you're ready. Keep working. Don't stop. Yeah, everything's being, yeah, exactly. Well, now this is some great stuff. I know none of us have signed non-disclosure agreements. I know we're all fearful that we may have some intellectual property we may be sharing. I'm just joking. Just joking. All right, here we go. Team 2. We want to hear it.
Okay, so we did healthcare systems closer to home. So we wanted to create a system dashboard within our institution that would measure wearable diagnostics analytically. It would have a human connection at the system, so somebody will actually answer your call, and also have a family connection or a peer connection. And that as these analytics, and if you're doing okay, and you check up 6 months, you're doing okay, you get a phone call, doing great, see you around. If as those analytics start to go south or north, whichever, blood pressure or something else, that it would then give you a call and say, hey Joe, we're noticing that you're getting elevated. We're gonna watch you for another 3 months, and if not, then we're gonna send an Uber driver, and we're gonna pick you up, and we're gonna put you all in all your appointments at the same time, in the same place.
All right, all right. So they talk about, you know, home care, we may need hotel care, right? After a couple of days here. Yes, that's concierge. So, all right, so any other teams ready? All right. Okay, introducing team number 1.
Well, our problem was improving the patient experience through numerous touch points, but we were trying to be more specific, and that is annual screenings, because they're a pain and nobody likes to do them. So we kind of were talking about this, and it's like, first of all, you go and you get it, and it's a pretty degrading experience. So where is the best place to have anything done? At home. And so much of the screening can be done at home anyway, you know? And so we kind of started looking at it from the Amazon experience, which is, I'm gonna make it so easy for you that you're going to want to do it, and it's not painful, and so that's what we're working off of. Now, I have technology on my wrist. A lot of things can be measured with this technology. It communicates with my smartphone. You know, I use my smartphone biometrically. I use it as my ID. You could use it with your medical health records. What do? You go into a healthcare facility and you talk to 15 people before you finally get service. They ask you the same questions. Well, why did they develop medical health records? So that's part of it. First thing is going in. You can go touch your phone. They know who you are, what's going on, and you go through and you do most of your testing there at home, and that information gets downloaded to the appropriate site. Now, what you don't like to do is talk to a lot of people, but you do want to have a consultation that's worthwhile. So when you finally do get to a doctor, do it through telemed. I mean, that really is a great way of doing it for your health screening. You get the information, the data is uploaded to that individual, to that doctor, and then he can give you a consultation, a real consultation where you get something out of it. So you're limiting the touch points as far as that is concerned. You're making it very, very convenient for people to do it. You broaden the delivery through the right clinicians. If there is somebody where you do need laboratory testing or something like that, you get the right people. You can have somebody come to your house, quite frankly, like they do with insurance. That could be all part of it. So insurance, and I know my insurance offers most of these benefits to be able to do it. They just don't put it all together and explain it to you. So I have to believe it's available pretty much for everybody. But that's the way it's done. And you know, on an annual basis, you also incentivize people by making it so that they get deductions or reductions in the cost of their insurance by doing it too. So these are kind of the ways that we see to solve that problem.
All right, good job. Round of applause, please. All right. Got table number 4. Here we go. Welcoming table 4.
I'll take technology for 400, please. So we kept leveraging the technology and the changing tech, and we decided to focus in on that 60% that you talked about, the 60% preventable stuff. And the discussion that popped up at the table was around diabetes and being able to be preventative and really look at that generation that's coming up that's sort of getting hammered by it. So how many people are wearing a Fitbit right now? Well, we thought Fit Kid could be something. So very similar to what you see with a Fitbit, but being able to leverage technology, look at apps, but really start being more proactive and preventative and make it fun and really bring accountability to the table. So each kid can see that they're doing movement each day. We can see maybe healthy choices. There might be part of the app that, hey, you're going shopping with mom and dad. You get 2 points if you pick that. You get X points if you pick that. And oh, based on everything that you picked, here's some menu ideas. And we thought maybe you could even at a local level team up the whole notion of just making better choice and getting educated on what happens when you put things into your body. Team it up with a local restaurant. And maybe there's a chef mentor that works with a specific school and goes in and teaches kids how to cook, very similar to what Jamie Oliver's doing over in the UK. But making it fun and a bit of a competition, because you can start looking at peer-to-peer. You know, who's done 10,000 steps today, or you know, who's actually climbed flights, who's gone out and had activity in the playground, all of those different things. And so badges and medallions could pop up, but it can be a family thing. And you can even start looking at, from that accountability, maybe an employer helps sponsor this and becomes a family thing where if you meet goals, guess what? You get X amount of money going towards your family health care plan. Things like that. Did I miss anything? Okay, team 4 out.
All right. Who's next? Ready? All right. All right, so the next group we have up is table number 5.
Okay, took us a while to get here, but we started to think about how we can bring care closer to home. And so it seems to be a common theme, right? So that and technology. But one of the things that we started to talk about is big data, and how do we leverage that information to actually predict how patients would be cared for or need to be cared for in our area. Then also focus on those 5% of the population that use, 50% of healthcare resources today. So comorbidities, diabetes, those kinds of things. Think about how we might affect value to those patients versus volume, and try to leverage that. Leveraging technology that we have today. So think about smartphones, think about tablets, think about smart TVs. All of those things people have today, and we can actually leverage that to be in communication and connect those apps that you were talking about, or those wearables, Fitbits, those kinds of things. It's all there. And we can continue to leverage that information as we look at that big data and those sources, and become, I'll say the Amazons of healthcare. And then also think about new technology, talking about Amazon drones, right? So one of the members here talked about drones bringing care to the patient, instead of a nurse, instead of someone, a technician, whoever, a drone could come, and they could even dispense drugs. Now, again, got to figure out how to do that and how to keep it safe, so that those things don't disappear. But it's definitely something to leverage and think about. And then when the patient does have to come, or when that customer does have to come, how could we make it a humanizing experience? As an architect, right? A lot of architects think about the design of space and how wonderful it is, but it's really about the experience someone has in that space that's important, and what they leave and what they remember. And so space can support that. Space becomes that platform, that operational platform, but it's not. But that's all it is. We're here to provide care, and that's what's really important. So. That's our thoughts. I don't know if we've fleshed it out completely, and I'm more than happy to have anyone else share anything else that I missed. Okay.
That's quite the challenge to be able to flesh out these ideas in such a short period of time. So good work. So we got 2 tables left. All right. You guys ready? 3. All right, here we go. Table number 6.
All right, well, we were focusing on elevating the patient experience by learning from other industries, specifically the hospitality industry. And I think we were able to define, a little bit better, first that you might consider local tours in your area of hotels and places that are providing great service and have great reviews or whatever, and see what they're doing. It was interesting to note, too, that a couple of folks in our group actually had implemented some of these things already in their buildings, either the idea of a concierge or using better kiosks and wayfinding. And we also had one person getting ready to implement single-point registration and then within a large clinical facility, and then single-point lobby within that the clinical as well, to sort of when you're caring for families, that they have a place to congregate that's not directly in the office of the lab or the clinic or the doctor's office where you're visiting. So we actually do have people implementing some of these things already, and then just considering how the lighting and the heating and the cooling and the landscaping and everything impacts that patient's perception of what is about to happen before they ever reach the dock. And that they have now a preconceived notion about the level of professionalism or cleanliness or comfort or whatever that they're going to receive. And so to continue to focus on those considerations when you're designing the building, as well as considering smells, considering sounds, and how all of those things impact the patient. So that's it. Yep.
All right, this leaves 1 table left. They want a long intro music, I can tell. Just always keep playing the music until they.
Okay, so the issue we decided to take on was planning amid increasing market volatility and looking at some of the different ways to mitigate some of the issues with some of the acquisitions. Really what we wanted to do in a broad sense was eliminate a lot of the subjective analysis that goes into some of this decision making and replacing it with more of a fact base. Doing that through leveraging some of the technology that we use on some of the newer facilities such as Revit and BIM, creating the barcoding, labeling, doing that with all the equipment, everything that's in a facility. So we know the age, the type, the make, the model, the serial, the history of that particular item, the repair history, maintenance history, and really doing all that to kind of create somewhat of a Zillow marketplace, I guess would be the best way to describe it, where we really could kind of get a fact-based analysis of that particular facility and do away with a lot of the individual subjective analysis that would go into that typically.
All right, thank you. All right, well, congratulations to all of you. You've done it. You've actually been through your first hackathon. Now, you know, anytime you talk to somebody and they say, have you been to one, you can say, yes, I participated in it. It does feel a little bit awkward. It is, you know, not quite as polished, but that's the whole purpose. That was the intent of today's session. Also, the other intent is to get the wheels turning and to look and talk and network with people that you're going to be bumping into these next couple of days and really learn from their experiences. Because I started off to say, you know, the smartest people are not necessarily where you work. It's where you can touch base with people like these networking events that happen all the time. So please take advantage of that. I know it probably pushed some of you a little bit outside your comfort zone, having to sit with a bunch of people you haven't met, but now you have some new friends in Palm Springs. Isn't that great? So thank you so much for your time today. I hope it was beneficial, and you can listen to all these things that came together and take something with you as you go. So enjoy your time here. Thank you very much.